فضلاً اشترك في القناة وفعل جرس التنبيهات حتى تصلك كل الفيديوهات.
السلام عليكم ورحمة الله وبركاته. Good morning everyone. I hope you're doing well and staying safe during the current circumstances. My name is Areej Al Abduwani. I am the Administration Director from Gulf Specialized Hospital, and I'll be the panelist with you today. I'll give you a few information about about the session today and how are we going to go about it. A bit of house rules. Everyone is on mute. Myself and the speaker, you'll be able to hear us. We have allocated 60 minutes for the session, followed by 30 minutes for question and answers. If you'd like to ask any questions, then you can use the question function in the software itself. You can send us your question and we'll get to it by the end of the session, inshallah. Few of the topics that we will be talking about today is how to manage workplace during COVID-19 and the current circumstances, how to improve the resilience of business in the current circumstances, how to safely take care of yourself, your employees, customers, suppliers, and ultimately your family and the community, workplace relations and occupational safety and health. A little bit of information about Gulf Specialized Hospital. We have actually started in 2015. We aim to be the optimal healthcare choice in Oman. We are located in Maktabi building in Al-Wathaya. We have more than 20 surgical and medical specialties. We highly depend on visiting consultants such as Dr. Pradeep, who are well known around the world in their respective fields. If you'd like to find more information, get more information about the hospital, the services, please visit our website. We will be sharing the slides with everyone after the session, inshallah. Our speaker today will be Dr. Pradeep. Dr. Pradeep is a neurologist consultant who's visiting our hospital once a month. Hopefully, inshallah, once things will settle down, he's going to start again. He is a highly recognized doctor in his field, certified from prestigious institutions from around the world, from the US, from the UK and Switzerland. Without further ado, Dr. Pradeep, if you'd like to share your plan so we can start with the presentation, please.
Thank you, Zuhair, for your nice introduction. Good morning, everybody. I know it is tough time for all of you. During this time, I'm very happy that Gulf Specialized Hospital has organized this program, especially for the sake of employers, for employers in whichever field they are, and how to manage their workplace during the toughest time which whole world and everybody is going through. I'm extremely thankful to the Gulf Specialized Hospital, all the senior people there, and the entire fraternity there for inviting me to give this talk. And I hope after this talk, you will get a fair idea of how to manage your business, how to go on. Because ultimately, whatever be the circumstance and situation, you have to go on, the world has to go on. Everybody has to move forward, whatever be the obstacle. So the purpose of this talk is how do we ensure uninterrupted work and allow business continuity, and how can we plan that? It is based on whatever scientific knowledge we have about this virus, how it spreads, and how we can stop preventing the spread of this disease in the community as well as among your workers, so that you can have an uninterrupted working schedule. So, just a few months, this novel coronavirus, which is called the SARS-CoV-2, has spread to nearly every country in the world. It has paralyzed the global economy. It has devastated the healthcare systems. It has sent large number of people into isolation distress, and it is really distressing to see the number of deaths. This disease, which is caused by SARS-CoV-2, is called COVID-19. We had similar epidemics before, which is the SARS as well as the MERS. All were having, actually speaking, high case fatality rates. But I would still say, start on a positive note, that the SARS-CoV-2 does not have that much case fatality rate as it was with the other two viruses. When the Ebola virus disease came, the case fatality rate was around 39.53. The SARS had a case fatality rate of 9.56. If you look at COVID-19, it has a case fatality rate of 4.9. So that is a positive thing. I wanted to start this giving some hope in the beginning. In line with the advice of the WHO, the World Health Organization, governments are imposing drastic measures, cutting down of non-essential activities, restricting movements of persons, even locking down the entire city, district, state or country. So that's the only way by which the governmental agencies can prevent the rapid spread of this virus, which has almost crossed more than 1 crore all across the globe. So it is in this situation, it is crucial that employers are making contingency plans to respond to different situations that arises. See, what is happening in COVID-19 is situation is changing, actually, I would say almost every day. It is not a static process. We cannot have the same way of approach to your life on a daily basis. You have to change according to, because daily some new things are happening. As we are knowing the virus more, we are implementing more new things to prevent the spread of the disease. So it was declared a pandemic on March 11th, 2020 by the World Health Organization. See, pandemic means it has spread all across. So many places are being affected simultaneously. From endemic to epidemic, it goes on to pandemic. And it is zoonotic in origin. What does zoonotic mean? This is normally a virus which is present in animals. And most probably it is a bat which is a source of this virus. And from then it has spread inadvertently to human beings. That should be the word which is used. And the infection ranges from asymptomatic to severe. I'll tell you, majority of the infections are asymptomatic, which means the person may be harboring the virus, but he will not produce any symptoms. Then there can be, majority will have asymptomatic. Now, I'll come back to it later, which has got an incubation period of 2 to 14 days, with a mean incubation period of 5.2 days. What does this mean? What does this incubation period mean? That is, the virus has entered into your body, but it has not started producing any symptoms. So you will not know that you are harboring a virus. That is the most dangerous situation. So you may be moving around with people and unknowingly, inadvertently, you may be spreading the virus. And the people are infectious during the incubation period. Now, this is the Wuhan province of China, from which the virus has originated. From here, this deadly virus, so-called coronavirus. I don't know why they gave the name corona. Corona is the nice thing which you see around the sun. Beautiful, this thing which is encircling the sun. But they have put a name of corona to this deadly virus which has spread. And this is the place from where it has spread. And initially, the beginning, in the January and all, everybody thought, Jan-Feb, there is some latitudinal preference for the location of this disease and where it is spreading. But this has been proven wrong. Just like that, so many things have been proven wrong in our assessment of this virus. And that is why I would say this is a dynamic process, things are changing and you should act accordingly. And this is the electron microscopic structure of this coronavirus. You see so many projections on the surface. This is called the S protein, of which the S protein is very, very important, because it is the S protein which is causing the attachment of the virus to the cells, and that is how it gets into the body. So, how does this virus enter into the body? This virus, as I showed you the S protein. This S protein has attached itself to so-called receptors. So, see, body has got receptors for this virus, which is present in the cells which are lining the system, especially the respiratory tract, which includes your nose, your trachea, your this thing, and your the air pipe and the lungs. This endothelium has got receptors, and this virus goes and gets attached to these receptors, and they enter into the human system. So whichever tissues are having these receptors will be affected by this virus. This is present in the kidneys. This is the ACE2 receptors. It is present in the muscles. It is present in the brain. All these organs are affected because of this COVID-2 disease, COVID-19, that is the SARS-CoV-2. So, what are the symptoms by which this disease present? The classical triad of symptoms are there as far as the COVID-19 is concerned, or the SARS-CoV-2, which is fever, cough, and breathing difficulty. That is the triad, the three things which are the hallmark of this COVID-19. If these three are there, then you should suspect. In this present scenario, all across the globe, you are dealing with most probably suspected COVID-19. Along with that, WHO has told, we have seen patients having anosmia, which is loss of smell, ageusia, which is loss of taste. They can have severe muscle aches, which I told, the ACE2 receptors are there in the muscle. Then gastrointestinal symptoms like diarrhea, then headache. Then on top of this, if suspected infection and the person has traveled to an affected area, they have been exposed to a known or affected case, or exposure to a healthcare system where severe respiratory infections are managed. Now, okay, fine. Let me tell you something. What are the complications? Complications are ARDS. This is acute respiratory distress syndrome. Patient has to be put on ventilator. Septic shock, the blood pressure drops. It affects the myocardium, kidney, multi-organ failure, and stroke. We are seeing a lot of strokes nowadays because of this virus related. Probably what this virus does is it causes what is called as it causes coagulation of blood in the blood vessels, both in the arteries as well as the veins. So we are getting both arterial strokes as well as venous strokes in COVID-19. Now, see, this is the chest X-ray of one of the patients with COVID-19. The one on the left-hand side, the earlier part of COVID-19, as the disease is progressing, you see the diffuse lung involvement. This is very classical and characteristic of COVID-19. And if you see the X-ray itself, you are able to make it out. And if you do a CT scan of the chest, you get a classical ground glass appearance. So now, this I told you about the ACE receptors and how the virus gets into the system. One word of caution. So you know this before we talk regarding the risk factors of COVID-19. People who get the disease become more severely affected if they are very old age. As the age advances, the disease becomes more severe. The people past the age of 80 years are most vulnerable to get severe disease. Those who have other comorbid conditions like diabetes, hypertension, heart disease, kidney disease, immunosuppressed state, either due to medicines or due to cancer, they develop severe complications of COVID-19. Okay, so now one word regarding smoking and COVID-19, which is not touched upon at many places. See, my dear friends, the smoking is dangerous at this particular point of time. You know what this does? It has been in some elegant studies which have shown that smoking increases the ACE2 receptors in the respiratory endothelium. So if there are more receptors, there is more chances this virus can attack, and once you are infected by the virus, it can enter into your system. So don't smoke. This is one of the most common non-communicable disease in the world. If you ask me, it is tobacco addiction. According to the WHO, there are 1 million tobacco smokers in the world. So what does it mean? They are all able to spread the disease. They are all capable of developing. These tobacco smoking people get all these complications, heart disease, all these things. They are the most vulnerable group, and this may cause a rapid spread of the disease. So this is one of the areas where extreme precaution should be taken, and the people should stop smoking. Now, after having said all these things, how does COVID-19 spread? According to WHO, when someone who contracts COVID-19 coughs or sneezes, they release droplets containing the virus. Most of these droplets fall on nearby surfaces and objects such as desks, tables, or telephones. Workers could catch COVID-19 by touching contaminated surfaces or objects. Then they touch their eyes, nose, or mouth. If they are standing within 1 meter of a person with COVID-19, they can catch it breathing in droplets in the air. So that is the most dangerous situation. That is why the social distancing and personal distancing come in here. Otherwise, very simple. COVID-19 spreads in a way similar to flu, the simple common flu. Now, I will tell you a small thing. If I spray a virus, so don't get panicked by all these things. If I spray this COVID-19, coronavirus, SARS-CoV-2 into your nostril, if I take 100 people and spray this virus, you know what happens? In 60 of them never develop any symptoms. In 20 of them, there will be mild symptoms. That is 80%, there's not an issue. The remaining 20 people develop severe symptoms, and they will require hospital admission, of which 1 person will die, or at the most 2. So what is the case fatality? 2 things are here. You should not get confused. One is called the infection fatality rate, other is the case fatality rate. So how many people have died? Of all the 100 people whom I have sprayed the virus, only 1 died. So the infection fatality rate is 1% or less. Whereas, what is the case fatality rate? Of the 20 people who required admission, 1% died, which is 1 by 20 into 100, which is 5%. So the statistics from the hospital is of those patients who are getting admitted because of the severe COVID-19, who developed a severe pneumonia, who developed an acute respiratory distress syndrome, or a stroke, or kidney injury, and septic shock. But that is not the scenario in the general public. So it is a case fatality rate is high, but your infection fatality rate is less than 1%. Now, very, very important question which should be addressed is, can we get coronavirus infection from people without symptoms? See, why I am highlighting this, because recently there was this thing from the WHO, very recently, telling that asymptomatic patients will not spread the disease. But, almost immediately, what happened was, within 3 days, they changed the statement. Dr. Liam Smith, who is from the London School of Hygiene and Tropical Medicine, said this cannot be true. Asymptomatic patients do transmit the infection. The WHO changed their stand. They said, okay, fine, it is well known. There's a chance of, when you are harboring the virus inside your system, which is the incubation period, which I said is 2 to 14 days. During that period, you are infective to other people. So be very careful. Be very careful. In that situation, you have a chance of spreading the disease by 40%. 40% is a chance of spreading the disease. That is why you may not be knowing you are harboring the virus. Inadvertently, you can spread the disease. That is where the role of preventive measures come in, which will come to in the form of masks, which will prevent, even if you exhale, even if you cough or sneezes, the chance of another person developing the disease is very less. So beware, asymptomatic people can spread the disease. So that is one of the danger signs, one of the dangerous things which is happening with regard to the present pandemic. Now, how can employers protect workers and the workplace? Generally, as all of us are aware, employers have a duty to ensure the safety and health of their workers and others, not only the workers, the people who come, your customers, your suppliers, others in the workplace. This includes providing and maintaining a work environment that is with adequate health and safety facilities for workers in carrying out their work, and you do it reasonable with practicality. Most national health and safety legislations have such provisions. To address COVID-19, employers should monitor advice provided by the national and local authorities, including on work arrangements, and communicate critical information to the workforce. Assess the potential risks of business disruption, because don't allow your business to get disrupted because of some things which you have, which you can do to prevent it. It is a question of adjusting yourself to the situation. Situation has arisen that you should be able to change the attitude in which you look at things. You cannot do the same way you have been doing. Review or draw up a business continuity plan that is consistent with the guidelines offered by your national and local authorities to enhance business resilience and to help workers and their families. You have to be a little bit resilient at this time, more flexible. Identify and reduce risks to workers and other persons connected to the workplace arising from exposure to COVID. This is very, very important. You have to identify the areas by which the disease can spread, prevent it. Promote workplace hygiene. Apply the principles of social distancing, also called physical distancing. You know, you are learning new terminologies now. Social distancing, that is what the virus has done. Social distancing, physical distancing, quarantine, and you're sanitizing more now. Assess business liability for workers' compensation, particularly in sectors with high work-related exposure to COVID-19. Seek advice and support from the employees and business management organizations who can channel concerns to the government and shape policy measures that are conducive of business resilience and sustainability. So the entire purpose of the talk is to how to maintain your business resilience and business sustainability. Should employers provide information to their workers? Yes, you have to, because this is the time when most of the people are actually, the workers are not there. They are now actually in a great concern. They don't know what to do, what is happened to them, what will happen to their job. This is the time when you should provide maximum information to the workers, correct information. If you cannot provide personally, identify a person or a team to take the lead on communication regarding COVID-19. Keep up the latest information from national and local authorities. That's what I told. Every day the information is changing, how you should react to this virus. Regularly provide up-to-date and reliable information to workers, which I think everybody can do. There's not much expense in it, but it can help in running the business. Clarify and communicate the company's procedures and policies, including for the work arrangements, remote working, absence, sick leave, annual leave, redundancy, etc. Then there are a lot of guidance from the WHO on COVID-19, which you can freely download. The guidance for employers on getting your workplace ready for COVID-19. You should have dashboard on novel coronavirus situation, daily situation report, providing figures on confirmed cases, deaths by affected countries, areas or territories. You should display so that people are aware what is happening, how many people are getting freshly infected, how many people are getting positive, how many deaths are happening in the country or in the area where you are staying. Avoid the advice for public. There are so many mythbusters, even WHO has provided. This you can get it from this website. Now, what should employers do to safeguard workplace safety and hygiene? Every workplace can play an important role in containing the outbreak by taking measures such as organizing work to reduce person-to-person contact. That is the most important thing as of now. You try to reduce the person-to-person contact as much as possible. That is the only way by which you can prevent the spread of this disease, by doing what is called as physical distancing at the workplace, or implementing, if that is not possible, you can, if some work, particular kind of work can have remote work arrangements, you can do that. Disinfect the workplace regularly. It can be easily done. I will come to the disinfectants in a short while, which maintaining good environmental hygiene, good indoor ventilation. Good indoor ventilation is extremely important, because otherwise, when a person comes to you, I will tell you, when a person coughs or sneezes, in a normal conversation itself, some 20 to 200 viral particles will come out. When a person coughs or sneezes, some 200 million viral particles can come out. And imagine, this is there in a closed space, air-conditioned space. There's a chance that whoever enters into that room can get the disease. So it is ultimate or extreme importance that your ventilation facilities should be very good to prevent the spread of the disease. Provide adequate facilities. Soaps, provide soaps, hand sanitizers. Have enough signage, and to encourage workers to practice workplace hygiene. You have to do it repeatedly, which we have all been doing, because these people will forget, because they have been not used to that. Frequent hand hygiene. Avoid eye touching. Frequent touching of the eyes, nose and mouth. That is how the virus spreads from contaminated surfaces. Promoting respiratory hygiene. That is providing face masks to workers, especially those who are at risk, to minimize potential infection. These things can be easily done at your place, Then, if travel is needed, you have to limit or ban non-essential work travel. Before a travel is needed, think twice. Is it necessary at this point of time for the business activity? If reducing interaction with people outside the workplace as much as possible, you empower workers to take action if they feel they are facing an unprotected situation and they have an imminent risk to their health. Developing infection control policies and procedures internally within your organization itself. Directing workers to comply with quarantine measures, particularly following travel to a high-risk area or had contact with someone who have tested positive. This is extremely important. Directing workers to stay at home or work from home if they have some flu-like symptoms, which I told, fever, cough, some muscle aches, regardless of travel or contact history, because they could be asymptomatic carriers. Complying with the reporting obligation to health authorities, labor inspectorate according to national legislation and practice. Now, a terminology which is used very frequently. The moment you switch on your TV, you see this physical distancing and social distancing. What does it mean? Social distancing or physical distancing actually refers to keeping at least 2-meter distance between people. This is actually recommended. Why? This is to deliberately increase the distance between the people to prevent the spread of the virus. You see, when you're coming into direct contact with people, in their exhaled air or the sneezes or coughs, the viral particles will come. If you keep much distant away, the chance of getting it is less. At least maintain a 1-meter distance. At the workplace, this means implementing flexible work arrangements, for example, teleworking, increasing physical space between workers at the workplace, implementing flexible meetings and delivering services remotely. For example, holding meetings via video conference, just like we are doing now, But phone calls, considering if large gathering can be rescheduled, staggered or cancelled. Changing workplace culture is very important. You stop your handshaking. You can greet a person by bowing or waving. Workers taking lunch at their own desk rather than in a cafeteria or break room. Limiting sharing of the gathering in the workplace. Reconsidering non-essential business travel. Then another very important thing which has been utilized by many places is delivering products through curbside pickup or delivery. How can employers manage and control the risk of COVID-19 in their workplace? Identifying and controlling risks from COVID-19 to workers or other people may involve closely monitoring the official guidance. This is the time when you have to really adhere to the health authorities. It is the national or local health authorities. And their daily bulletins you have to go through. Then you can have your own internal policies based on your resources. You can step up, don't step down to increase the infection control things, including the most important thing is educating workers on best practices on safety and hygiene. It's very, very important. You have to do it daily. Otherwise, because this is not part of their routine so far in their life, so they may tend to forget. It is our duty to ensure that they are taught daily. Ensuring workers are aware of the isolation quarantine periods in line with the directive or advice from the national and local authorities. Providing clear advice to workers about actions they should take if they become unwell or think they may have symptoms of COVID-19. Then, monitoring the latest travel advice, restriction for anyone planning travel for work. Assessing whether work activities will put other people to risk. Contingency planning to manage. You should have your own planned staff, manage staff absences, plan to manage increasing workloads. Provide workers with information and links to relevant services should they require this support. Always feel free to contact your relevant national and local health information hotlines or helplines for COVID-19 for latest information and headlines. I think all the nations are doing this. And ILO has suggested put certain particular group of people as highly vulnerable, especially those who are the front line of dealing with the pandemic. They are the most affected. Healthcare workers. That is why we have all been called as COVID warriors now. Especially the women. They outnumber in the healthcare working industry. Unprotected workers and migrant workers. These are the people who are more prone for this. What should employers do if a worker has recently returned from overseas? He should do self-quarantine. What do you mean by if you're doing a self-quarantine? You must not attend work, school, childcare or university. Must not go to other public places such as restaurants, cinema halls, anyway, they are all not open nowadays, or shopping centers. Must not use public transport or taxi because you may tend to spread it to other people. Must not allow visitors into your home. Only those who usually live in the household should be in the home. Even with them, you maintain a distance, at least 1 meter. Must stay in a different room to other people as much as possible. Here again, employers are advised to refer to the quarantine or isolation guidance issued by the WHO or the national health authorities. What should employers do if worker is required to be quarantined upon returning from overseas? Allowing the worker to work from home where feasible during the quarantine or isolation period. Allowing the worker to utilize other leave available, such as annual leave, sick leave, banked overtime, or any other leave available under a collective agreement or contract of employment. Using any other paid or unpaid leave by agreement between the worker and the employer, sick leave, discretionary leave, etc. So, what should an employer do if a worker has been in close contact with one who has or may have COVID-19? Required to self-quarantine, there's no doubt about it, because of the possibility of actual exposure to virus. What does in close contact with mean? Here, according to the definition, according to what WHO is, if it is greater than 15 minutes face to face in any setting with a person who has been tested positive for COVID-19. In a period extending just 1 day before the onset of symptoms, up to almost 2 weeks, you should be taking it as in close contact. Sharing of a close space with a person who has tested positive for a prolonged period, that is more than 2 hours, extending for a period 24 hours before the onset of symptoms in a confirmed COVID case, or living in the same house or shared accommodation as an infected person. These are all you have been in contact, close contact. What happens if a worker's immediate family member contacts the COVID-19 virus or his or her children's school is closed? Here it's an emergency situation for the family. That is, somebody in the family is sick or the children's school is closed, you have to take care of them. In this case, the worker is seeking leave due to closure of the child's school, so they have to take care of them. In the absence of legislative or contractual provision, in such a case, you have to permit the worker to avail the accrued paid leave, permitting the worker to take unpaid leave, developing a flexible plan to worker use telephones, the internet, or any other office methods to do moderate work at home, while also fulfilling the family responsibilities. That is why they ask for the leave, like spending time with his or her children and supporting their education without jeopardizing income security. What do international labor standards say on workers being able to quarantine themselves from a situation that poses work-related health and safety issues? A worker reports forthwith to his immediate supervisor any situation which has reasonable justification to believe it presents an imminent and serious threat to his life or health until the employer has taken remedial action. If necessary, the employer cannot require workers to return to work in such a situation, which is continued imminent. It's because that dangerous situation is still there. In such a situation, you cannot force an employee to come back to work. Can employees send a worker home if he has symptoms of COVID-19? There is no doubt about it. There is absolutely no doubt. Employees, they have the legal responsibility to ensure the health and safety of those working in his own premises. When an employer believes that a worker is posing a health risk, such as by showing symptoms of the COVID-19, the employer has every right to send the worker on sick leave on the basis that they are unfit to work. Employers should ask the worker to seek medical advice, get a testing done, and come back with a clearance certificate before returning to work. If the worker still maintains that he can work, whether it is practical for him to work from home, that is up to the employer. Once a test is undertaken, the worker may return to home if he or she is cleared. What should employees do if a worker is required to travel overseas or within the country for work? Travel to be avoided or minimized during an outbreak till COVID-19. But if the travel is totally unavoidable, make sure both the employees and the workers have the latest information on the areas where the COVID-19 is spreading, which is easily from the national website. You can get it. Avoid sending workers who may be at high risk of serious illness. That is the most important thing here. There you should use your judgment. Avoid sending older people. As I told you, those are the people who are more vulnerable for this disease past 65. Those with medical conditions such as diabetes, heart disease, lung disease, and who are taking immunosuppressive medicines, they should be prevented from travel. Make sure any worker traveling to locations reporting COVID-19 are briefed on the involved and precautionary measures to be taken, and review with necessary protective measures such as face masks, alcohol-based hand sanitizers, and they should be asked to do regular hand washing. Encourage workers to wash their hands regularly and stay at least 1 meter away from other people. Ensure workers know what to do, on whom to contact if they become ill while they are traveling. Ensure workers comply with instructions from local authorities where they are traveling, including complying with the local restrictions on travel. That's what I told. Every day things are changing. You may think that you may be traveling to one place, suddenly that place may become a hot spot. because of the increased number of cases, and you will not be allowed to enter. So before you start your travel, identify which are all the hotspots, where you are allowed to travel, or which are all the containment zones, and please avoid large gatherings wherever you're going. Now, should visitors be allowed in the workplace? Taking extra precaution by limiting workers to the workplace is important at this point of time. But that doesn't mean they should not be totally avoided. While it not be necessary to ban visitors coming to the workplace, they have the employer has the right to ask the visitors to provide information in advance whether they have any COVID-related symptoms, have traveled abroad, or are they in the quarantine period. If the visitors answer affirmatively to any of these questions, they should not allow the visitor to come to this place. If you feel they are in the quarantine, or they are come into contact with somebody who is having the virus, or they are showing mild symptoms of flu, they have to be isolated for 14 days, then can provide a clearance letter from a doctor. Employers may also ask the visitors to provide contact information. Please get the contact information even if they are visiting, because we don't know at this point of time, it may be useful. What should employers consider before implementing a policy on working from home? Reducing face-to-face contact is an important measure to mitigate. That's one of the most important things. That is why, if possible, some type of engagements they can work from home, but not all. Healthcare workers, those in the front line, they cannot work from home. But certain establishments, the workers can work from home. Make sure they have the appropriate equipment, technology, and training that are essential for staying connected to the organization. They are provided to them. Clear expectations are set for both managers and workers about the work and the condition. Time sovereignty should be given to the workers so that they feel more comfortable to finish off the work. Safety and health risks are assessed, and reasonable preventive action in relation to working from home is taken if it involves manual tasks, hazards and risks, electrical safety, and the environment, regarding the working environment, noise, security, first aid or fire exit. All this has to be assessed. Potential risks that the worker has reported are assessed, including any specific risk regarding violence from home, that is domestic violence. Workers' obligations are agreed around issues and policies such as working hours, confidentiality, working practices while working at home. Ensure that the workplaces are suitable. Establish means of contact between the employer and the worker, and pre-arrange means of commitment. Now, other precautions which are taken while working from home are, you have to enable your data security, because there is a transmission of data from a remote place. So we should make sure that employees should make sure that the transmission of the data is safe. Then the person who is working should have sufficient skills regarding the technology which he is using. Otherwise, you can train them. Online training can be utilized to refresh the skills in this area. And third is the well-being. Offer varying work tasks to ensure the workers are not working in the same position for a long period. This is for their health reason. Set up equipment in such a manner to minimize twisting or reaching. Have enough workspace for the equipment and any other materials needed to carry out at the work. Encourage workers to take regular breaks to stand and move from time to time. What other general supports and means of communication should put forth for workers working from home? Employees should consider the following. All contact details for workers are on file and agree on the means of arranging regular updates via phone, web or email with each worker. Providing workers with emergency contact numbers. Arranging information technology support in the event of technical problem wherever it is relevant. Provided workers with information detailing when they need to contact their employer. Make sure work is organized in such a way that the worker takes regular breaks that which can separate his or work life and daily life. That is very, very important. Provided workers with regular feedback on their work, encouraging workers to maintain contact with colleagues. What are the alternatives if teleworking is not feasible to the nature of the occupation? Like frontline operations, healthcare, manufacturing, assembly lines, construction sites, shipyards, plants. Here you cannot have online working or working from home. You reduce the duration and proximity of physical interactions, use of teleconferencing facilities, limit number of attendees, shortening the time. You can stagger the working hours to reduce the congregation of workers at common spaces, There should not be any staggering during the time of lunch or other breaks. Better they can have their lunch from their own table. Reporting and end times should not coincide with peak hour travel, especially if they are using public transport. Defer non-critical events and scale down critical work events. For the events that are critical to the business and operations that cannot be deferred, employees should limit the number of participants at any point in time, put in place precautionary measures such as online registration, reduce the crowding of participants, that is, participants are seated at least 1 meter apart, remind participants to practice social or physical distancing, encourage workplace hygiene, frequent hand hygiene, avoid touching eyes, nose and mouth, provide adequate facilities and preventive gear, alcohol-based hand sanitizers, face masks, reduce the mingling of participants such as during meal times, improve ventilation where possible, open windows, weather permitting. So, friends, this was once upon a time our OPD. This is before Corona, not before Christ. Now, what has happened now? Yes, see how you can space your chairs. You see the straps which are put across so that there is a 1 meter distance between two people. This can be easily done. Hand wash is the best. Hand wash at least for 20 seconds as the WHO. Using sanitizers. Hand sanitizer, you can have a mechanical stand sanitizer. Those are affordable. They can have an automatic sanitizer. Done. 70% alcohol is the best sanitizer which can be used. This is sanitizer usage is not now, it was even there, you know. This is Aladdin asking Jasmine to give the hand and she's asking him to sanitize before touching. Now, the masks. This is the various 3-ply mask, the N95 masks. How masks help, you know? See, very, very important, probably one of the most important slides in the whole talk actually. Please refuse to rate closely with anyone not wearing a face mask. It is your right. You can tell them, I am not going to come close to you. Sorry. Why? COVID-19 carry, suppose, if you look at the first one on the top, COVID-19 carrier is without a mask, whereas you are wearing a mask. What is your chance of transmission possibility? It is 70%. See, it is 70%. But COVID-19 carrier is with a mask. You are not wearing a mask. What is the transmission possibility? 5%. Look at the last. The COVID-19 carrier is wearing a mask and you are also wearing a mask. What is the transmission possibility? It is only 1.5%. Remind this. So hereafter, you will ask everybody to wear a mask. Now, mask C, protecting yourself. These masks will prevent the entry of the viruses into your system. Okay, so whether it is I have compared the cloth mask, surgical mask and the N95. Particles leaking through the mask, if it is an N95 is only 1, if it is a cloth mask it is 33. If you are spraying 100 particles, whereas a surgical mask will allow 25. Protecting others if you are wearing an N95. That is, if you are wearing an N95 mask, the particles which are going out is also very, very less. Outward protection for a cloth mask is only, 90% of the particle will go out if you are wearing a cloth mask, whereas if you are wearing a 3-ply mask, surgical mask, 50% of the particles will go out, whereas if you are wearing an N95, only 30%. So that is the difference between an ordinary homemade mask or a cloth mask, surgical, and N95 mask. See, if the usage, can you reuse an N95 mask? You can actually keep it dry it for 5 days, and you can use if you have 5 masks, the first mask can be used on the 6th day, like that. So you can keep it. You are not supposed to keep it on the sun or heat it at a high temperature. It will destroy the electrostatic layer of the N95 mask. Now, can employees scale down operations in light of falling demand? As a result of measures taken by the government to reduce the spread of COVID-19, business in some sectors has suffered sharp decline in terms of revenue. Cost-saving measures can be done by scaling down operations, place a freeze on new hires, reduce any supplementary labor such as contractors, reduce worker working hours, provide annual leave or long service leave in advance or at a reduced payment, encourage workers to take leave without pay, etc. What are the steps and procedures to be taken before making a person redundant? Due to measures taken by some governments to restrict or temporarily scale down business activities or falling consumer demand, some employers are eventually forced to reduce the size of their workforce. Before making any worker redundant, it is important first to consider whether there are any options for redeployment within the business or associated entities. The applicable national laws, regulations, and government policies and directives should be taken in the context of the current situation. Now, can they lay off workers? When a business is so severely affected, there is no other option. You may have to lay off the workers, but still then consider the following options. Redeploying workers to other parts of the business where available, reducing in hours or days of work, encouraging workers to take accrued paid leave, such as annual or long service leave, exploring alternative leave arrangements such as extended annual leave, half pay or no pay leave. What are the obligations of employees concerning discrimination, harassment, or bullying? See, here there is no doubt. Having a policy and implementing measures to prevent and deal with discrimination, you should not discriminate at this point of time. Providing training to workers to reduce social stigma. Encouraging workers to be proactive in reporting incidents of appropriate or indiscriminate behavior. Have a procedure in handling complaints. Encourage the wide and non-discriminatory use of complaint and reporting machinery. Identifying cases of discrimination and promptly responding to them. Employees should start doing these things now, even if a COVID-19 has not. See what the employees should make sure your workplaces are clean and hygienic. Surfaces, that is desks and tables and objects, telephones, keyboards, mouse, to be widely disinfected regularly. Because contamination on surfaces touched by employees and customers is one of the main ways of the COVID-19 spread. Use Lysol, which is benzalkonium chloride 80%, or 1% hypochlorite solution. Lysol can be used on computers, keyboards, telephone, lift buttons, lift walls, and objects. Both hypochlorite followed by Lysol for floors, wall, granite tabletops, stairs, rails, tables, and chairs. If you are fumigating, use 11% hydrogen peroxide and diluted silver nitrate. Promote regular and thorough hand washing by employees, contractors, and customers. Put sanitizing hand dispensers in prominent places around the workplace. Make sure these dispensers are regularly refilled. Display posters promoting hand washing. Combine this with other communication measures such as offering guidance for occupational health and safety officers, briefings and meetings, and information on intranet to provide hand washing. Make sure the staff, contractors, and customers have access to the place where they can wash their hands with soap and water. Because why? Very important. Washing kills the virus on your hands, prevents the spread of COVID-19. Promote respiratory hygiene in the workplace. They should cover their face with a tissue paper when they are coughing, when they have a running nose. Because good respiratory hygiene prevents the spread of COVID-19. Advise employees to consult national travel before going for any business trip. Briefing your employees, contractors, and customers that COVID-19 starts spreading in your community to anyone, even when a mild cough or low-grade fever, which is considered as above 37.3 degrees Celsius or 99 degrees Fahrenheit. They should stay at home or work from home. Don't take simple medicines such as paracetamol, ibuprofen, or aspirin and come to work. They can spread the disease to others. Keep communicating and promoting the message that people need to stay at home even they have mild symptoms of COVID-19. Extremely important to prevent the community spread. Display posters with the messages in your workplace. Combine this with other communication channels commonly used in your organization or business. Your occupational health services, local public health authorities, or partners may have developed campaign materials to promote the message. Make clear to employees that they will be able to count this time off as sick leave. Why do employees and organizations need to think about COVID-19, how to manage COVID-19 risk? When you're organizing a meeting, there's a risk that people attending your meeting or even might be unwittingly bringing COVID-19 to the virus to the meeting. Others who are coming for the meeting will be unknowingly exposed. You have no business to spread the disease. So you have to check the advice from the authorities when you are holding a meeting. You should have a clear-cut plan. But consider whether a face-to-face meeting or event is needed. Could it be replaced by a teleconference or online event? Could the meeting or event be scaled down so that only few people attend? Right. Pre-order sufficient supplies of your tissues and hand sanitizers before the meeting. Have surgical masks ready. If anybody develops respiratory symptoms, I would say all should wear masks, not with respiratory symptoms. Actively monitor where COVID-19 is circulating. Advise participants in a manner that if any symptoms or feel unwell, they should not attend the meeting. Make sure all organizers, participants, caterers, and visitors at the event should provide their contact details, telephone number, email, and address, and where they are staying. State clearly these details may have to be shared with local public authorities if needed. If they will not agree for this, they should not be allowed to come for the meeting. Develop and agree a response plan if somebody develops illness at the meeting. You should identify a room or area where they can be isolated. Have a plan where they can be safely transferred to the health facility. Know what to do if a meeting participant, staff member, or service provider tests positive for COVID-19 during or just after the meeting. Agree the plan in advance with your partner health care provider or the health department. During the meeting, provide information or a briefing, preferably both orally and in writing, on COVID-19 and measures that organizers are taken to manage. Build trust. For example, as an icebreaker, practice ways to say, greet a person without touching. That is very, very important in any meetings nowadays. Encourage regular hand washing. Encourage participants to cover their face with a bend of the knee or with tissue. Supply tissues and clothespins to dispose of them. Provide contact details or a health hotline number. Display dispensers of alcohol-based and hand rub prominently around the meeting place. Arrange seats with sufficient spacing. Open windows and doors. Sufficient ventilation. If anybody who starts to feel unwell, follow your preparedness plan. Thank all participants for the cooperation with provisions in place. After the meeting, retain their name and contact details. If someone at the meeting or event was isolated as a suspected COVID case, organizers should let all participants know this because they can take protective and preventive measures. Even if they develop a mild cough or low-grade fever that is 37.3 degree or more, they should stay at home and self-isolate. That's it. They should avoid close contact less than one. It should be more than 1 meter with the nearest contact person. They should also use telephone their healthcare provider, the local public health department, giving them details of the recent travel, these symptoms and their symptoms. Thank all participants for the cooperation with the provisions. Before traveling, make sure your organization has the latest information that is COVID is spreading. Based on the latest information, you organize your travel plans. Avoid sending employees high risk to patients to the high risk who are highly sensitive to develop this COVID for the travel. Make sure all persons traveling to locations reporting COVID-19 are briefed by a qualified personnel, which is staff health nurse, services healthcare provider, or local public health partner. Consider issuing employees who are about to travel with small bottles of less than 100 ml of alcohol-based hand rub. This can facilitate regular hand washing. While traveling, encourage employees to wash their hands regularly and stay at least a meter away from people who are coughing or sneezing. Ensure employees know what to do and who to contact if they feel ill while traveling. Ensure that your employees comply with instruction from local authorities while they are traveling. If, for example, they are told by local authorities to go somewhere, don't enter this place, they are supposed to comply with this. Now, when your employees return from traveling, employees who have returned from an area where COVID-19 is spreading should monitor themselves for 14 days and take their temperature twice a day. If they develop even a mild cough or low-grade fever, there's a temperature, as I told, they should stay at home and self-isolate. This means, again, I said, should avoid contact, close contact, 1 meter or nearer with other people. Getting your workplace ready in case COVID-19 arrives in a community. Develop a plan what to do if someone becomes ill with suspected COVID-19. This plan should cover putting the ill person in a room or area which are isolated from other workers in the workplace, limiting the number of people who have contacted the sick person, contacting the local health authorities. Consider how to identify persons who may be at risk and support them without inviting stigma and discrimination to your workplace. Promote regular teleworking across your organization. if there is an outbreak of COVID in your community. Teleworking will help your business keep operating while your employees stay safe. The plan will help prepare your organization for the probability of COVID-19 in the workplace or community. It may also be valid for other health emergencies. So, communicate to your employees and contractors about make sure plan they're aware what they need to do or not to do according to the plan. Emphasize key points such as the importance of staying away from work if they have only mild symptoms or have. Don't take simple medications like antipyretics and come to work. Now, as I told, curbside delivery and curbside pickup is one of the easy ways of dealing with COVID-19 see even the pickup van, even the actual trailers, you can do that so that your business does not get affected. Top 5 rules which we do in our healthcare, in our hospital. Minimize person. We don't allow people to bring anything inside our chamber. You maintain distance from the patient. You should lessen the surfaces of contacts. Constant reminder by the staff, doctors, and you constantly teach your staff how to undergo the safe practices of hygiene, whether it is cough hygiene or hand sanitization. Then, it is extremely important to notify if there is a known quarantine case comes to you, there is a known travel case to an area where COVID-19 disease is spreading, you have a suspected case. This is one of the prime duties of every citizen, because it is a duty of every citizen to prevent the spread of this disease in their community. So if every citizen tries to do this, only the spread of this disease can be prevented. We advise display this signboard: one patient, one attendant, no visitors. Then, don't clutter your table. This is my table. This is my consultation table. You see, we don't keep anything. You're neat and clean. You don't keep your cell phone there. You don't keep your coffee. You don't keep. See, normally doctors have tendency to keep all the pamphlets, so many books, everything on the table and make it a mess. See, this is not the time for that. It is keep it spick and span. You sanitize it daily at least twice, so that you are minimizing the chance. Don't clutter your working table. Then, lift operation. You can do it with a toothpick, or you can keep sanitizers in the lift. Then, does UV rays work? Not known. It will be pretty expensive. We have seen at one place where they have spent almost in Indian currency some 45 lakhs, but I don't think it is approved and it is of proven value. Now, regarding the cash payment, this is what we do. They see how a sister is demonstrating it, how she's showing her credit card through this thing. The other person is taking it and swiping it and putting it on a tray and giving back. This is how you don't face to face. You're not coming into contact. Even if it's cash payment, you keep it in a drawer. And you take the change from another drawer and give it, and you don't touch the cash for nearly 3 to 4 days. Then only you're taking it. Then prevent. Very, very important. Avoid ill patients. Diligent hand and cough hygiene. Avoid large gatherings and unnecessary gatherings. Telecommunicate. When going out in public, use masks. Avoid handshakes. Social distancing at least 1 meter. Mitigate psychological and emotional toll of social distancing from family and friends by doing a video chat. Avoid touching faces unnecessarily. These are almost the 10 commandments which you face. This is one of the markets from which avoid this, from which the COVID is spread. So this type of this thing should not happen. I don't think hereafter such things will happen, because people have realized the importance of maintaining social distancing. Now, before I conclude, I want to talk a little bit about as of now, as the treatment is concerned, not much actually. Still, vaccines are about to come. Drugs which are useful, not the specific hitting drugs are not there. So, of course, we treat patients and many of them recover, but still a vaccine is about to come. So, how do you improve your immunity? How do you do that? The 3 pillars: adequate rest, exercise, and immune boosters. And regarding the immune boosters, you have to what are the 3 pillars of immunity? You have to take plenty of amino acids, for which you can try a lot of sprouts. You have to take vitamins and minerals. These amino acids are important for antibody formation, protection. Vitamins and minerals. All these minerals, especially I would highlight zinc, selenium, and iron. which are important for, again, formation of your antibodies. Then these zinc, iron and selenium are present in all these black raisins, dates, strawberry, watermelon, papaya seeds. Now, regarding your vitamins, vitamin A, C, E, D. These are present. You don't have to remember all these things. If you take plenty of citrus fruits, you get a lot of this vitamin C. Take your turmeric, black pepper, take a lot of these nuts. There's dry fruits, badam, walnut, all are rich in these, these vitamins. You take ginger, garlic, green tea, broccoli, spinach, even capsicum is rich in all these antioxidants. So you maintain a healthy diet, you increase your immunity, you take adequate rest. That will be one of the most important things which will help in preventing the spread of the infection to your system. And I told you already about the never smoke because of the propensity for the virus to enter your system. We have started using telemedicine. We are doing it very successfully because this prevents the person from entering into a system where the viruses are there. They don't have to come to a place where you are there and you have a chance of getting a viral infection. This runs your business. Telemedicine is very effective. Now, this is what the BMW, they have given 8 points where you're supposed to clean, sanitize before you enter it and once you get out. So I also do it. This is one of my car also. So I like this statement by German Chancellor Angela Merkel. Very, very important statement. Nobody likes to hear this, but this is the truth. We are not living through the final phase of this crisis. We are still at its beginning. We will still have to live with this virus for a long time. So, I think I have been, even though I spoke for 1 hour, I think talking about this takes a long time. A lot of things to be spoken about this. Life has to go on. Business has to run. Everything has to go on. I think knowledge is the most important, powerful thing which will help in circumventing this problem. Don't lose hope. Things will be all right. I don't know whether it will be set to the same like before. Like this social gathering and all, I'm sure it is going to be less now because people have realized the importance. But if you understand the philosophy of maintaining a healthy environment where you work, even not only now, even in the future, you are liable to put yourself and your workers into less risk of developing not only this COVID-19, any viral disease, any bacterial disease for that matter. So with this, I would like to conclude and wish and pray that this pandemic will end soon. Thank you very much.
Thank you very much, Doctor. It was very informative, a lot of useful information. Again, we will be sharing the presentation later on. So you could go through the points and we'll share our contacts as well. If you had any questions, you could ask us later on. Dr. Lam, I have a few questions that people have asked. We'll take some time just to answer them. There are some questions which are repeated, so I'll just mention the most common ones. First of all, Doctor, will COVID-19 virus spread through paper? In the workplace, usually we might be sharing papers or we might be handing over documents from a department to another department. So could that cause the spread of the virus?
Okay, theoretically yes. But practically it is the chances are very little. By practicality, it is very little. Because I'll tell you, what happens is that, see, this is a viral load which matters in spreading the disease. So if you ask me, will it spread? The answer is yes. But what are the chances of spread? I will explain. See, when it's a viral load which enters your system, that makes you vulnerable. Few viruses, no, it cannot. It cannot. Your defense system is good. If your defense system is good, it will take care. If your B lymphocytes, your T lymphocytes, your macrophages will dispose of a couple of viruses. For normal talking, I told you there are around 20 viral particles which come out. Whereas I told you, see, if a person coughs or sneezes, see, there is no way in which when you touch, there is no virus on your skin, unless you touch a surface where a person with a COVID-19 have coughed or sneezed. and that viral particle is there on the surface of the paper. Then if you touch it and take it to your eyes, nose and mouth, then only it will spread. It is if in your office is nobody is having a COVID infection, nobody is there even in the incubation period. That means, how do you know that? If he has not come into contact with a person who is affected with COVID, or he has not traveled to an area where the COVID-19 is containment zone, then it's very, very unlikely. If nobody is in the, for example, in your office is harboring the virus, then it should not spread. Then there is no need of this thing to be on a paper. But if it is coming from outside, that is a different question.
Yeah. Okay. And I think, Doctor, that is why it's very important to wear masks, because even if someone was in the incubation period and they did not know, then they would have to protect themselves and others as well.
Yeah, that is so important, That is one of the, I think if that is really taken, if people obey that, if they see, then I think half your problem is over. Because if you wear a mask, I told a beautiful slide actually. In fact, if a person who is tested positive for COVID-19 is wearing a mask, and if you are not wearing a mask, if as a normal person, then your chance of getting the disease is 70%. Whereas, if a person with COVID-19 is wearing a mask, and if you are not wearing and both of you are wearing a mask, your chance of spreading is only 1.5%. So from 70%, you are reducing it to 1.5%. That is, if 100 people come into contact with a person with, suppose a person X is affected by COVID-19, he is wearing a mask, he is coming to a place where 100 people are there. Only one person or at the most two will develop the disease. The rest will not. And you know who that one or two will develop the disease? Who are immunocompromised, who are having some deficiency in the immune system, having some comorbidities like diabetes, heart disease, or a kidney disease. Those people will develop the, or somebody who is a smoker, he is likely to get a disease. So it is not that. So there's no need of a big panic, provided it is highly important that you both wear masks. I would say preferably a 3-ply mask, not a cloth mask.
Doctor, you have mentioned discrimination in workplace in terms of COVID-19. I got a question, and they have asked if someone got infected and recovered, can they infect again? Perhaps if an employee got infected, stayed home for the quarantine, came back to work, could they probably infect others after that time, or could they get infected again as well?
It is a very good question. It's a very good question. Actually, you see why this 14 days quarantine is kept. Let it be very clear to them. Why? I told you, there is, for every organism, there is something called as an incubation period. The incubation period for this SARS-CoV-2 virus is 2 to 14 days. And the mean incubation period is 5.2 days. 5.2. What does it mean? Suppose a person is getting a virus into his respiratory system. This virus will produce a symptom in him normally within 5 to 6 days. And the maximum number of days is 14 days. Okay. And a person, suppose if he's in quarantine, he has recovered from the disease. It is not, then his antibody will be positive. His IgG antibody will be positive. But if you look at his throat, how do you diagnose? You do a PCR, RT-PCR. The RT-PCR is the one which detects the viral particles in the throat. Within 5-6 days, his RT-PCR will be negative once he started developing the symptoms. So once 14 days is too good a period, then there will not be any viral particle in his nasopharynx or oropharynx. So that person highly unlikely to transmit the disease. Highly. You can accept him.
All right. Doctor, another question is, what if an employee doesn't follow the precautions required by workplace?
Pardon? Last part I didn't hear.
if an employee did not follow the precautions that the employer have put in place, what should they do? So let's say an employee is refusing to wear a mask or use, hand wash or sanitizer, and
employer has got every right to send him off. This present point of time, every right, because I'll tell you, because that particular employee is risking the life of other employees also. You are not supposed to do that. This point of time, every person has to moral responsibility to see to it that the other person is not affected. You have no right to cause an infection to others and disrupt their health and spread the disease. If an employee is not complying the employer's order of you have to wear a mask or you have to hand sanitize regularly, then employer can take any action against it.
Another question, doctor, is that the number of COVID-19 positive cases is increasing on daily basis in Oman. How can we control the spread of the COVID-19?
Yeah, very nice. Actually, this is the problem which every country is facing. Every place is facing. The number of cases are increasing. Why? Because the people are not following what all we said. First of all, not wearing masks when they are going out. They're not following the social distancing, which is told by the WHO and the national government. And they are, for example, I'll tell you something. We have not shut down. We are having a hospital. We have plenty of cases even now. With God's grace, we have been able to follow strict guidelines. What a person does, patient comes to your chamber, what the first thing he does is he lower the mask when he talks to you. He lower the mask. Then we have put a poster outside. If somebody lowers the mask, whether it's on an outpatient basis, when I'm going for rounds, either the patient or the attendant, I will not see that patient that day. This has been circulated because you have no right to jeopardize or spread the disease to others. So if they are not doing purposefully, because they have not been used to do that. When you talk to a person, they want you to see their face. It is not that they are doing it for the sake of spreading, but it's a lack of knowledge. That is doing it. That is why this disease is spreading like anything. If every citizen in the world has to now protect the world, that is the situation which has come. If it is not taken care of, this disease is going to peak again. It is going to peak further down this year by November, something like that. And another thing which can happen now is there's something called as herd immunity. What this herd immunity is, that is how many of the diseases have got under control. As this disease spreads to many people, their immune system, their antibodies develop, their immune cells start becoming more functional against this virus. Then when the virus jumps from one person to other, there is a lifespan for these viruses outside. They cannot survive for more than 24-48 hours. So when they jump into another person and if the virus finds that person's immune system is strong and it is able to destroy, this virus cannot spread to that person. Then that chain is broken when the immunity develops in the community. That's called as herd immunity. That is going to happen. That is the way, if you ask me, that is one of the ways in which this pandemic is going to stop. And of course, the vaccinations are going to come. It is going to take some time. But we don't know at what time it is, because for a good vaccine to develop, it takes easily 1 year's time. It has to be tested. It has to go through phase 1, phase 2 and phase 3 trial before it gets implemented. So before that time, it is a duty of every citizen to see to it that he follows, he puts a face mask when he goes outside, he cleans himself when he comes from outside, even the chappals, everything he keeps outside, just like the older tradition, and he sanitizes everything. And the sanitizer, we talk so much, but I would say simple soap and water is the best way of destroying the virus. The virus cannot stand up soap and water. It destroys the virus. If strictly by maintaining your sanitization, increasing your sanitization standards, if you are having a cough or a mild fever, stay indoors. Stay indoors. Don't go outside. If you have even a mild cough, wear a mask. Keep a distance of 2 meters from the other people. That is the only way I think this disease spread can be controlled. Otherwise, it is going to go up till a herd immunity develops, number one. Secondly, till a vaccine comes.
All right, thank you. One more question, doctor, is regarding snacks. The snacks, what type of snacks do you advise us to take while at work? Type of snacks that increase our immunity and help prevent or reduce the chance of getting COVID-19?
Very nice. This thing. Actually, one of my fascinating areas. Actually, see, in your place, I'll tell you, you get a lot of these dry fruits. You get a lot of. You try to take most of these dry fruits at that time. And secondly, you use the fruits like papaya, strawberry, watermelon. You can take your black raisins, dates, plenty in your place. All these are very rich in minerals, antioxidants. Then you can use your orange, lemon. So you switch over to that system. Kiwi. All those things will give you not only antioxidant, vitamins. It will really improve your immune system actually. And of course, green tea you take. You take green tea, rich in antioxidant. You take yogurt, which is yogurt is good. You can take that. That if people not diabetic, you can take honey. All these things you can take, and of course you can take pulses. Any form of pulses is good. It will supply you with rich of this thing, vitamins, fortified grains you can take. So that will what my suggestion would be.
All right. Another question, doctor. As an employer, how can I fulfill my responsibility to ensure a healthy and safe workplace?
No. Can you please repeat that question?
As an employer, how can I fulfill my responsibility to ensure a healthy and a safe workplace?
Oh, that is exactly what I told in my talk actually. This is exactly what I told in my talk. It is so many simple steps to be followed. So many simple steps. That is the one thing, you keep your workplace clean and tidy. Clean and tidy. For example, you have to sanitize your workplace at least twice. At least minimum twice. The sanitization, not only I'm talking about not the hand sanitization, I'm talking about sanitizing with Lysol or with sodium hypochlorite, which we are doing at least twice. Even we do it twice actually. See, you can 1% sodium hypochlorite, 80% benzalkonium chloride, or you can even fumigate with hydrogen peroxide. That we don't do. We do the other two things. You can keep your sanitization of your place. Number one, you restrict the number of people who are coming to your place. Don't allow unnecessary visitors, if only it is absolutely needed. Secondly, before you want to have a face-to-face conversation or face-to-face meeting with a person, think twice. Is it really needed? Can we do it on tele? Actually, should we actually take a tele conference? Would that suffice? Then, if you want to ship your things, or if you want to have your pickups and everything, you can do a curbside pickup, which I told. You don't have to use your pickup from somebody to deliver it at your place. You can have a curbside pickup in a neat and clean manner. And avoid, in your place, you don't allow people to congregate, for example, lunchtime or the coffee break. Let them not go and have this thing. And even at those places, everybody should wear mask if you are doing that. Our best thing to do is, you can have your lunch or this thing on your table itself at this point of time. And you check your temperature of the people. There's nothing wrong in that nowadays. We do it for every person entering into your hospital. They have to undergo that thermal morning and evening. It is being done. So that anybody above 37.3, we don't allow inside degrees centigrade. So you can do an infrared temperature. This thing, so that you don't allow a person who is having even the slightest of the temperature to come inside. So that way you can ask, and you can ask them regularly. Be in touch with them, find out whether they are in contact with somebody who has come from who are in quarantine. That is another big risk, which we face. People who are in quarantine are coming out as bystanders, attenders, and so that should be taken care of. And these are the ways in which you can do that.
Doctor, another question, as everyone is using alcohol sanitizer. Actually, the question says, overusing alcohol sanitizer, can it affect the skin?
Okay, but this see, that is a good question actually. Not many people have looked into it actually, not because nobody was using it to this extent, you know. This very this thing nobody was using to see. Previously also we were using hand sanitizers. There's nothing. Each time we go into a person whom we think ICU, we do hand sanitizing, or before in the evening when we come out or when we go for lunch we sanitize. But this year I've been sanitizing every other 5 minutes. Every 5 minutes. So that can be, if somebody has got a sensitivity, that can cause a problem. I don't deny that. I think in such people who are little conscious, they can probably wear gloves. That we do, because nowadays, you know, we are always, when you're seeing as healthcare system workers, we wear glove and we change it almost for every patient. So that avoids a lot of this thing actually.
Another question: how many hours can I use the same mask?
Pardon?
How many hours can I use the same mask?
Okay, the same mask. Okay, which type of mask you're talking about?
Let's say the surgical mask, the medical mask.
Surgical mask. Okay, surgical mask. See, if it all depends on whether it all depends on where you are, which situation you are. If you are just going out on this thing, and if you are not going, if there is a good spacing in between the people, that good personal distancing in between the people, you can usually use it from. There is no problem in using for 6-7 hours. But that is not the situation when you are in a hospital. Not the situation, because when we go to this thing, when you are meeting patients, and when you think that there is a chance that the viral load is going to be high, probably I would recommend changing it maybe 2 hours or 3 hours.
All right, Doctor, another question. You have spoke about some snacks and probably some vitamins to take to raise the immunity, and the question says, to gain a strong immunity, it takes a lot of time. So if we take the snacks, will it really help? Will it really give us that strong immunity that we are hoping for? And they're asking for the reference on the immunity part as well.
Okay, can you repeat it once more, the last part?
They're asking as well for the reference on on the snacks, basically affecting the immunity.
Okay, fine. It's a good thought actually. But let me ask you. I will have to put it this way. It is always better. It is always better to take these immune boosters. You know, it always better. Definitely, it is going to help you only. Definitely, it is going to help you only. The timing of which the immune system will react to it is a little different issue. But you see, you are taking a green tea. It has got antioxidants in it. You are taking walnuts, which is rich in, actually speaking, the minerals and vitamins in it. See, this is definitely going to support your enzymatic activity in your body. This is definitely going to, it is not like taking something which is going to be detrimental to your health. Definitely, it is not going to lower your status of fighting the virus. The trace elements, because these are all needed. Selenium, for example, I tell you, selenium, zinc, amino acids, these are all needed for producing the antibodies day to day. Day-to-day production of antibodies is needed. Suppose if you are getting contracted with a COVID-19 virus, how will your system act? It will produce antibodies against the virus. What are these antibodies made up of? Amino acids. So if you are eating amino acids, if you are eating the micronutrients, definitely it is going to help in synthesis of your antibodies, and definitely it's going to help in fighting the infection.
All right, since we are running out of time, this is the last question, and then we'll be wrapping up. They're asking, Doctor, about taking blood from a recovered person. Will it help affected people with COVID-19? I think they're talking about the plasma, perhaps.
Yeah. We have tried it here in a few patients. this is plasma antibody, the plasma which is rich in antibodies, and the results are not very encouraging. Results are not. Maybe in a few instances it has helped. It has been tried in a few instances in Delhi actually, but after that it has not gained any momentum actually. But theoretically, strictly speaking, yes, it should, because what fights the virus is antibody factor is one of the things, but antibody is not the only thing which fights the viral disease. Viral disease, you need a lot of cell-mediated immunity also. Cell-mediated immunity very difficult to transfer by giving in the plasma. Fundamentally, it has to come from innate system. So my personal feeling is it is not highly recommended.
Okay, with this we come to the end of the session. I would like to thank you, Dr. Pradeep. A lot of useful information, and inshallah, everyone will take a collaborative effort in fighting this disease and reducing the spreading of COVID-19. I would like to thank as well Oman Convention and Exhibition Center for their cooperation in setting up this webinar, and of course thank you all for your attendance with us today. We will be sharing again the presentation by tomorrow through emails with the email addresses that you have registered with us. We will share as well our contact information and Dr. Pradeep's email address. If you have any questions, if you'd like to contact us, please, we are there to help and serve you in whatever way we can. Thank you very much. Thank you, Dr. Pradeep, and please stay safe.
Thank you, sir. Thanks everybody.